Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. So, today I wanted to talk about why inductions take so long sometimes. Not always, sometimes, depending on what that cervix is doing, it wants to play along, and other times it doesn't. And really, the cervix is what is going to be the deciding factor on this induction. So we talk with our clients about this thing called a Bishop score. When you get a cervical check done, what the doctor is doing is creating a Bishop score for you. And so, what does that even mean? Well, they're looking at how soft your cervix is, how thinned out it is, if it's dilated or not, if it's still posterior facing backwards or midline or anterior. All of that gives you a criteria. You get a number. Based on that number, says how likely the induction is to be successful. Now, it's all relative, as we know. We've known people who have like a 0 Bishop score still have a vaginal birth, and those people who are really set up and have a very high Bishop score have pretty quick inductions. Everyone's different, especially first time moms. What a lot of people don't understand is that they say they're being induced, but they're supposed to show up at 7 p.m. the night before their induction. They think that that's the induction. Nope, you're being prepped for your induction. That's why they say come the night before. And so usually if that happens, they are putting possibly one of two different medications. One would be Cervidil, one would be Cytotec. There might also be an option for a balloon catheter, or like a Foley bulb is what it's called. All of those do different things. I could do Tuesday Talks on Cytotec, on the Cervidil, and on the Foley bulb as themselves. So I'll just tell you, like, those are usually the three options. There's so much more to that. There's pros and cons to all of them. There's bonuses and negatives and whatever. But really, sometimes it's up to the cervix. I mean, really, it comes down to the cervix. And so what needs to happen is the cervix needs to do three things. It needs to soften, it needs to thin, and it needs to dilate. And sometimes it takes a little bit of time. Sometimes the uterus is ready to play ball, and you feel like you are in transition, and maybe you're 1 centimeter. Meaning the uterus is ready, it's played its game, but the cervix hasn't caught up. Other times, you could be sitting there at 6 centimeters dilated and not even be in labor. That's usually for multiples, which, like 2, 3, 4 babies down the road, that might be something. Definitely usually not for a first-time mom. But again, now the cervix is ahead of the uterus, and they just need to connect. And so there's a lot that goes into it. So it's not about a timetable of like, oh, I'm going in for an induction, I'm going to have a baby at this time. It's really not it. What I think is the hardest part about inductions is they tend to be very long and slow. We want them to be slow. If they were fast and furious, most people would end up with fetal distress and a C-section, or you couldn't handle the whatever was coming at you, and you'd ask for a C-section. But really giving yourself the patience, knowing that inductions are just that. They are inducing, causing your body to go into labor, and that's not something that can just happen like that. If we've figured out yet why women go into labor, how we can get the cervix to play along, any of those people that figure that out are going to be in a yacht in the Caicos. But no one's figured that out yet. It's still one of the medical mysteries, the mystery of birth. They can't figure it out. It is what it is. So for some tips, if you're having an induction or you have a planned induction, bring stuff to do. Be able to watch TV, play some games, rest. Take that time to rest as much as you can. It's hard to sleep in a hospital, but you sure can rest. Talking to your doctor about being able to drink and eat as normal until labor actually starts, until you actually have a pattern of contractions. But sometimes hospital policy dictates what happens. And so for us as doulas, we're able to help navigate, here's what to expect. Here is the foreshadowing. This is what will happen next. And sometimes you don't get that from the support that you have at the hospitals because there's just not enough of the nurses to go around. Or you just have to ask the right questions, and it can get into a whole different thing. But I just wanted to come on today and talk about prepping for induction. Your induction usually starts the next morning with either your water being broken or Pitocin or a combination of thereof, or then a Foley bulb being inserted. Everyone's different in what that path looks like, so making sure to talk to your doctor about what is their preferred induction, what would be best for you, because you are not a cookie cutter, so what worked good for somebody else's induction might not be the best for your induction. And just having those honest conversations with your doctor, and then talking about who will be there for delivery, what do they what works for them, who's in charge of making the calls. Is it your doctor or is it the one on call? Really making sure that you're able to advocate for yourself and ask the right questions. When in doubt, use the acronym BRAIN. What are my benefits? What are my risks? What are my alternatives? What does my intuition say? And what if I do nothing, or what would be next? And nothing doesn't mean no, I'm not doing it. Nothing means like, what if we do something in like 2 hours and not just like right now? So that's what I've got. I hope you guys have a great Tuesday, and we'll see you next time. Bye.